Joining me now to discuss this important and urgent issue is Dr. Barbara Robles-Ramamurthy. She is an academic physician in child psychiatry. Doctor, thank you so much for joining me on the show. Good to see you again. I want to talk particularly about Black children and how they're impacted. But first, can you give me a general picture as to how COVID has impacted the mental health of all the children in this nation?
Yes, and it's an honor to be with you, Mark. And thank you so much for shining a light on this topic because we know that the more we talk about mental health, the more we destigmatize it, the more we make it bring awareness to our families and our communities. And so we know that COVID has just raised the layers of stress that children experience in their regular childhood and adolescence, right? And so they're already going through so many developmental stages. They are having to navigate a lot of peer social interactions, dealing with teachers, moving on to college, dealing with their families, with our families, right? Then, of course, for Black children, you add racism and all the social injustices that our kids are very well aware of. They know what's going on and they see how we adults and organizations are handling this. I think, from my perspective, one of the biggest issues that I feel the COVID pandemic has added on to the stressors for children's mental health is the fact that we have not learned as a society to slow down and adjust to situations
Mm.
of crisis. In some way, we're just acting like the world is, just going on as normal in a lot of different ways. For kids in particular, going back to school, we know that school can be really stressful for kids who have mental illness, intellectual disabilities, and other disabilities. And so I think adjusting can be very powerful if we know how to do that in a very purposeful, meaningful way for them.
Absolutely. You talked about the pandemic and you talked about all the social injustices that Black children are also facing. And that's an interesting point here, right? The pandemic and then there's racism. Can you talk a little bit more about how those two things simultaneously sort of operating against our young people, how that impacts their mental health?
Absolutely. Um, well, to begin with, we all have internalized racism in the way we view ourselves, how we see ourselves as worthy of love, right? So that's one layer of racism.
Hmm.
And kids internalize this very early on, right? There are studies showing that Black kids already see themselves as lesser than other kids who have lighter skin. And so there's already a layer there from a very early age. But then you add things such as discriminatory policies and practices that have been going on in our country for centuries, right, since the beginning of our nation. And that has resulted in inequalities in our communities, and how our neighborhoods look and what's available there and how well funded our schools are. And this is obviously going to trickle down to the kids and our families.
Another piece of this for me is social media. There's a way that against the backdrop of all this social media stuff, we can become somewhat desensitized as we're overstimulated with so much information, so many images and stories of death and sickness. Um, how does that affect children who have to see the images and hear the stories? And there's so much talk about things that 2 years ago they weren't even considering.
Absolutely. Absolutely. And just there's, again, different layers there in terms of the negative images and experiences that they're processing. Sometimes they're not even able to actually process those from a developmental standpoint. They might not have the words to share what they're understanding and how they're feeling about it. They might not have the emotional vocabulary to discuss it in a meaningful way. And a lot of times, as adults, we get so caught up in our own world, we forget to open up those spaces for them. That's one layer, the negativity that comes with that. Another layer is seeing the interaction of how we respond, adults and organizations, how, who is inflicting this harm on our communities. That is an extremely painful realization when you grow up being a little kid thinking you can be a police officer, and then you learn about police brutality and what that means for your community. That can be heartbreaking. And lastly, hope, and seeing stories of hope in our community. That's so, so important. Not doing it in a way that brings out toxic positivity where we're just disregarding the reality that we're living in, but showing a lot of hope, and the fact that community organizers are doing a lot of work to bring together leaders and experts and coming into our community. So I know that you're doing a lot of that with Black News Channel, so I'm grateful for that.